Basic dental terminology. This topic will give you the brief introduction regarding the basic terms used on daily basis in dentistry for routine diagnosis, treatments, and educational purposes. Starting with the oral cavity. Oral cavity is divided into two parts: the upper maxillary jaw or arch and the lower mandibular jaw or mandibular arch. Now, few terms used in dentistry on presence and absence of the teeth in patient's mouth. When patient having teeth in upper and lower jaw, patient is called dentulous patient. When patient having no teeth in upper and lower jaw, mostly old age patient, they are called edentulous patients. When patient having more teeth missing in his mouth is called partially dentulous patient. There are four types of teeth found in human. These are incisors, canines, premolars, and molars. The basic function of incisor is slicing and biting the food. An additional function to incisors is that they provide phonation and aesthetics. The canine provide basic function of tearing of food and aesthetics. The premolar provide function of tearing and crushing of the food. The molars provide forceful biting and chewing of food. Now, on the basis of the age, the teeth are divided into primary teeth or deciduous teeth and secondary teeth or permanent teeth. The primary teeth start erupting at age of 6 months. Eruption means the developmental process in which the teeth become visible into the oral cavity. There is another term used in opposite to the eruption is exfoliation, means shedding of the teeth. Deciduous teeth are 20 in number, that means 10 each upper and lower jaw. The one thing you must know is the absence of premolars in deciduous teeth. Each jaw contains 4 incisors, 2 canines and 4 molars. Here is a picture in which you can see the chronological ages of teeth on which they appear and shed or exfoliate. Mixed dentition, a period in which the permanent teeth are erupting and the deciduous teeth are exfoliating. So they both are present at the same time. That's why this period is called mixed dentition. Permanent teeth are teeth which appear after deciduous teeth. They start erupting at the age of 6 years. There are 32 in number and each jaw contains 16 teeth. There are 4 incisors, 2 canines, 4 premolars and 6 molars in each jaw. Here one thing you should remember is that permanent teeth do not exfoliate unless they are caused by any disease to lose their tooth. In this picture you can see different chronological ages of the different teeth on which they erupt and they exfoliate or shed off. Now for the treatment and diagnosis purposes, we divide upper and lower jaw into 4 quadrants, the upper left and right and lower left and right. This quadrant system helps us to understand the different nomenclatures of dentition. When we refer a patient or we treat a patient with a diagnosis, we use the quadrant system to identify the different tooth to be treated. So for this we use the different nomenclature system used in different regions. The nomenclature system include the most widely used universal system, the Palmer system and the FTI system. Different countries use different systems, but the universal system is most widely accepted system. For permanent teeth, the counting is started from the right third molar of maxillary jaw to the left third molar of the maxillary jaw, means 1 to 16 from the third molar to the third molar. For the mandibular jaw, the counting is started from the left third molar 17 to the right third molar 32. Here one thing you should remember that we always take left and right according to patient, not to ourselves. In order to make you understand this better, we will take an example of teeth number 22 according to universal system. So for this we will start counting from the 1 to 16 and 17 to 32, and this will be the tooth canine of the left mandibular jaw. In universal system, for deciduous teeth, A to T alphabetic system is used for the counting, from A to J for the upper jaw and K to T for the lower jaw. As we know, there are 10 teeth in each jaw, upper and lower jaw for the deciduous teeth. So, if we take an example of G teeth according to universal system for the deciduous teeth, this will be lateral incisor of the left quadrant of maxillary jaw. Palmar system is also a widely used nomenclature system in clinical dentistry. It uses midline to divide left and right quadrants. It uses mathematical digits 1 to 8 from central incisor to the third molars. This picture gives you a brief simplified example of Palmar system for the permanent teeth. And for the deciduous teeth, the Palmar system uses A to E alphabetic order from incisor to the molars. Another system used for the nomenclature is the Federation Dentaire International. By dividing the teeth into quadrants, each quadrant contains 8 teeth. So 1, 2, 3, 4, the different quadrants. So 1 by adding tens to it, 11 to 18 for the quadrant 1, 21 to 28 for the quadrant 2, 31 to 38 for the quadrant 3, 41 to 48 for the quadrant 4. Here's another picture for you people to remember this FDI system for the permanent teeth. For the deciduous teeth, the FDI system uses 5, 6, 7, 8 named quadrant. By adding 10 to them will give you 51 to 55, 61 to 65, 71 to 75 and 81 to 85.